The Cannabis Show is for information only. Nothing contained in the show is intended to constitute professional advice for medical diagnosis or treatment. We do not claim this information to be complete or exhaustive or to be applicable to any particular individual's medical condition. You should always consult with a qualified and licensed physician or other medical care provider.
Hi, and welcome to the Cannabis Show. Today, Dr. Stephanie Mason will be joining us. Also, we'll be talking about drug tests with cannabis in the workplace. Where are we with that? And also, we'll investigate the terpene limonene. Stick around. Hi, and welcome to the Cannabis Show. I'm Chris, and today we have a doctor in the house, Dr. Stephanie Mason. How are you?
I'm very well, thanks. How are you?
Oh, I'm doing well. Now, you've been with Natural Health Services pretty much from the get-go, but tell us, what exactly is your role with Natural Health Services?
I am the medical director of Natural Health Services, which means that I oversee the clinical staff and make sure that we're doing everything we can to deliver compassionate, competent care.
Oh, that's excellent. Now, What's your background, Dr. Mason?
I'm a physician, and I was a psychiatrist for 30 years. And I decided to do a shift in my career at a certain point when I became a bit disillusioned with Big Pharma and some of the ways that people were being managed medically. I think we had to sweep with a broader brush.
And so why was it medicinal cannabis then? You just knew, or you had an inkling, or?
It was a very strange series of coincidences. I have a big interest in addiction, and the problem that I ran into with that was we got no traction in terms of funding or getting help to sort of build a facility for people that struggled. And shortly after that sort of fell apart, I met Steve, our business partner, and he was interested in getting a clinic up and running, and I thought, why not? So that was in May 2015, and since then it has shown me the way, I guess, because we've been able to do harm reduction for people with substance use problems, but it's so much bigger than that. And sorry.
No, it's cool. So where you've been, from 2015 and where we are now in
Yes.
2017, what would you say is like the biggest challenge from a doctor's standpoint when it comes to medicinal cannabis?
I think the biggest challenge is the pushback from other physicians, the government, the College of Physicians and Surgeons, and the lack of willingness to learn. That's been by far the greatest frustration for me.
So I guess it's still a fight out there then.
Oh yeah.
Yeah. And why do you think there is a backlash? Are people just being naive, or?
Well, I can tell you that 3 years ago I would have probably been in the other camp because I didn't know enough about medical marijuana to be sort of fair about it. And I wouldn't fill medical marijuana prescriptions for my patients. But the more I learned, the more I realized that the medications that I had been prescribing for 30 years were causing harm. And so it was time for me to take a second look at what I was doing.
Okay, well, so that's the background. Let's just move a little forward. Now, when patients do come in to you and say hi, what's pretty much the most popular ailment that they're coming in for?
I thought about that question, and I think the biggest ailment is suffering, both physical and psychological. From a physical perspective, it's pain and pain management, and from a psychological perspective, it's anxiety, depression, insomnia, and the stress of our world that is really hard on people.
And do you find that the medicinal cannabis is helping?
Very much.
Yeah. Again, speaking with Dr. Stephanie Mason, a doctor with Natural Health Services, you see it all the time on social media, and this is so popular. Cannabis, cancer.
Yeah.
And I know there's hundreds of different types of cancers, and there's many different types of cannabis as well. But what can you tell us about that? Does it help directly, or?
Well, there's been what we call outliers. We've seen patients that have gone into remission unexpectedly after stopping chemo and going on to cannabis as palliative care. These are unusual situations, but they're baffling to both the physicians and happily for the patient. So does it cure cancer? I don't know. Can it potentially reduce the rate of growth of a tumor? I think so. And can it actually cause the tumor to be destroyed? Possibly.
Yeah.
There aren't enough studies to confirm that it is an anti-cancer drug per se, but it really helps with the side effects of chemotherapy and the pain and nausea and appetite. So it's been huge in terms of reducing the chemicals that those patients have to take.
Yeah, that's exactly that's what kind of answer I wanted to find there. Now, you said more studies. Like, how much more studying needs to be, or money needs to be put into medicinal cannabis?
You know, I'm not sure. I think that where I sort of stepped away from the medical profession was reading the evidence-based medicine that really wasn't evidence-based. It was funded by drug companies. The data was not what I was seeing clinically. And so I became very disillusioned with that. So one of the things I can say with certainty is the absence of things that have been discovered about cannabis is highly significant in that it doesn't kill people, it doesn't cause liver toxicity, it doesn't cause domestic disputes, it doesn't cause kidney failure. Whereas a lot of the medication that I've been prescribing has a lot of secondary, very negative side effects.
Yeah, no, it does get pretty scary out there. What about children and cannabis? You know, you hear, like, I got friends that, you know, their children have seizures and stuff, and how are we seeing that improve?
Well, again, it becomes a matter of harm reduction, because I see kids with seizures who are on very addicting, very high potency anticonvulsants, and their pediatricians are not open to cannabis. So the way we got into this was a mom came in who had bought illegal cannabis oil for her son who was having seizures and was getting some improvement. So we offered to treat him with the traditional Charlotte's Web that has been known to help kids with seizures. And he went down to 0 seizures.
Really?
Yeah. And it was amazing. So the other area of childhood treatment lies in cerebral palsy, spasticity, myoclonic seizures, ADD. Because again, the stimulants that we're using on kids have huge side effects and potentially long-term downsides.
Where would you like to see medicinal cannabis go from here?
I would love to be able to establish a harm reduction program for people with addiction. We've seen many, many patients come off opiates spontaneously without even a formal program. I would like to see cannabis used as a first line for pain. I would like to see cannabis used as a first line for epilepsy in kids. Where do I see it going? It's almost too big to look at, but I can tell you that it's been the best part of my career.
Are the doctors getting trained on this at all now in college or universities?
No. So what we've got upstairs in the clinical team is a group of people who are dedicated to learning about cannabis, and I've got a wonderful team working with me who all know a lot about the different strains, how they affect different parts of the body, and how to direct patients to use them, and they've been amazing. So we're all learning together about this.
Excellent. Now, Dr. Mason, what would you say? I mean, you've already said a couple like little stories in there too, but what's just one of your like favorite standout stories so far with medicinal cannabis?
I think one of them is a man and wife actually who came in just after we opened, and he had stage 4 throat cancer, and she was heavily addicted to opiates. We offered him cannabis to help him eat and with his nausea and pain. And I saw them a year later, and he was in total remission. He was one of the miracles, It was amazing.
Oh, that's excellent.
It was amazing.
So how long ago was that?
That was, I saw him in November, December.
Okay.
And I met him for the first time a year before that. And then his wife was off all her narcotics.
Wow.
So.
And are there plenty of those type of stories to go around?
Yep, absolutely.
Excellent. Now, Dr. Mason, before you go, and thank you for taking the time with us on our show, the Cannabis Show, what is one thing you would like a first-time patient to Natural Health Services, what was there one thing you'd like them to know?
What I want them to know is that we're here to help and to deliver compassionate care. What's happened in our system is that we've grown so quickly that patients are getting frustrated by the wait times and by, just being sort of thwarted by the sheer numbers. And we want people to understand that we're doing our best to set an excellent standard of care and that we care about them. So I guess that would be the number one thing, is that we want people to feel better after they leave.
Dr. Stephanie Mason, thank you so much for today. That is awesome. Thank you very much. That is Dr. Stephanie Mason of Natural Health Services. And who knows, maybe we'll have a question for her or for us. You can always tweet your question to @NatHealthServe, or you can ask us a question at the Cannabis Show at naturalhealthservices.ca.
Limonene has a boiling point of 176 degrees Celsius, 349 degrees Fahrenheit. Found in high concentrations in the rinds of citrus fruits, limonene is commonly used in perfumes, household cleaners, and medicines, and boasts a very low toxicity in humans. Medicinal benefits range from treating anxiety and depression to stimulating the immune system. Limonene has been shown to help suppress the appetite, aiding and promoting weight loss. This terpene aids in digestion, prevents gastric distress, and is even antifungal, making it a natural remedy for athlete's foot. For larger amounts of limonene, look to strains like Super Lemon Haze, Sour Kush, and Lemon Sour Diesel.
The Orwell strain, also known as Alien Dog, is said to be useful for the everyday grind, known for the effects of making one feel happy and uplifted while also creating a better sleep. Now, don't let the Orwell name scare you. This strain will make you feel like you're far away from a cropped animal farm or in the novel of 1984, although I think that really is happening. Orwell, or Alien Dog, because Orwell didn't scare you enough, is 70% indica and 30% sativa. Orwell also has 4 prominent terpenes too, including caryophyllene to fight depression and limonene, weight loss, cancer fighter, and bronchitis. Speak with your doctor and bud genius. Orwell could very well be in your near future.
Orwell.
Yeah, this stuff from Organigram, it's they call it Orwell, but it's actually the strain called Alien Dog.
I find that the Chem Dog parent really shines through in there with that clarity of mind, with those indica-like effects.
Exactly. This is a perfect example of a daytime indica, right? Like I would use this daily, first thing in the morning. Actually, it's fantastic. Got that really good split between that really mental clarity where it keeps you focused. And then those body effects start to come in. Great for back pain and things like that.
Yeah, that pain will just melt away with that.
Yeah, it's really good. I mean, the reason they call it Alien Dog, the stuff is out of this world, man. Like it's pretty good.
That's right. That's Orwell. That's the Alien Dog.
Yeah.
Canada is federally regulated for legalized prescription cannabis. That means that it doesn't matter if the licensed producer you choose is in your own province or across the country. And process and delivery times are generally the same, give or take a day. You can find a list of licensed producers on our website.
Hi, and welcome to You Can Ask Us Anything. To my right, I have Basil, and we have Hart at the end. I'm Chris. This gives you an opportunity to ask us questions, and if you have a question, you can tweet it at NatHealthServe, or you can email the Cannabis Show at naturalhealthservices.ca. Today's question comes from Nicole, and she says, I'd like to know if someone could get a positive result for cannabis in their system when someone in the household is using a vape in another room.
Well, Nicole, that's certainly I can see why you'd be concerned with that. I'm going to put your mind at ease. There's absolutely no risk of you testing positive on any kind of urinary drug test for any cannabinoids, let alone THC or CBD for that matter. In fact, you could have someone sitting right next to you vaporizing cannabis and you would still not test positive.
Another thing too, if you're worried about smell at all, you can always go ahead and purchase something like Smoke Buddy. It's a filter that you're able to exhale your lungful of cannabis through.
And that takes away the smell?
Yeah, it's a charcoal filter. It's gonna clean that right out.
Good for people living in apartments and stuff?
Great idea.
So really what we learned from here is something that Bill Clinton said years ago, but he didn't inhale. So if you don't inhale, you should be clear though. Is that right, Hart? Yeah?
Yeah, for sure.
Excellent.
Yeah, you're all good.
Nicole, thanks for your question. And again, if you have a question for us, tweet at NatHealthServe, or you can email your question to thecannabisshow@naturalhealthservices.ca.